It's very much interesting case, that's corrected transposition of great artery. In case of 25 years old female patient, because patient complained of shortness of breath during the labor pain, that's why patient was presented for echocardiography. In this apical four chamber view, what you see, this is left atrium, this is right atrium. From left atrium, right ventricle is coming. You can see that this is tricuspid valve because it's more apical, more close to apex compared to this mitral valve. So valve that is close to apex is tricuspid valve. So this is right ventricle. You can see moderator band also, and chamber is very much rough, so not very smooth. You can see in this image, this is apical four chamber view. So this is the case of corrected transposition of great arteries, and in case of 26 years old female patient, because in that age group usually we don't find this kind of case. So this case came to us because of shortness of breath. Now the next image is same thing, again the same thing. In this image, what you see, this is right atrium, this is left ventricle, and this is pulmonary artery. So right atrium to left ventricle, that is AV discordance. From left ventricle to pulmonary artery, that is BA discordance. So finally, that double discordance is getting corrected. That is why we call it corrected transposition, because 2 times discordance finally getting corrected. So right atrium to left ventricle and left ventricle to pulmonary artery. You can see this is pulmonary artery branch. This is main pulmonary artery, this is pulmonary artery branches. So right side right pulmonary, left side left pulmonary artery. So this is right atrium, left ventricle, pulmonary artery. Similarly, in case of left atrium, right ventricle, and then aorta. Now the next image. You can see the rough portion of right ventricle compared to left ventricle. So this is left atrium, right ventricle, right atrium, left ventricle. So tricuspid valve is more apical. You can see them easily see in this image. This is left atrium, this is right ventricle, this is right atrium, this is left ventricle. In this image, you can very easily see this is right atrium, this is left ventricle, and this is main pulmonary artery. You can see this main pulmonary artery coming out of left ventricle. Again, same thing. If you focus in this image, you will find this is aorta. This aorta is anterior and left of that of pulmonary artery. Because why aorta is anterior? Because transposition you will always find the aorta anterior to pulmonary artery. But in this case is also left sided, because aorta is coming out of left sided structure. That is right ventricle in this case, because there is AV discordance also. So from left atrium, right ventricle, from right ventricle aorta. So ultimately aorta is coming from left sided structure, that is right ventricle. So aorta is anterior and left. That is the point to know. Aorta is anterior and left, that is corrected transposition. In this case, what you see is severe TR jet, because the right ventricle is unable to pump properly. Ultimately, right ventricle is failing. The valvular mechanism, tricuspid valve is not managing. So severe TR, that is why patient is experiencing shortness of breath, especially when patient makes any kind of exertion. During the labor pain, patient made exertion and patient had complaint of shortness of breath, especially during the labor pain. That is the point of severe TR. Almost whole of left atrium is being filled from left TRZ, because left atrium to right ventricle. Left atrium is giving blood to right ventricle. So this is severe TRZ, and severe TRZ is filling left atrium. That is the point to know. Again you see the same thing. TRZ is severe. You can see the severe TRZ. That is the region. That is the region that the patient is having lots of severe TRZ, and that is why patient is getting shortness of breath. So in this case, either tricuspid valve should be repaired or replaced if repair is not possible. So this is the right ventricle chamber. This is aorta, this is pulmonary artery. Aorta is anterior and left to pulmonary artery. That is the feature of corrected transposition, because aorta is coming out of right ventricle. The right ventricle is situated in the left side. So ultimately aorta is coming from left side and anterior to pulmonary artery. Again you see the severe TRZ. And severe TRZ is the cause of shortness of breath. So that is the point to know in case of adult patient of corrected transposition of great arteries. Thank you.